I'm talking with Dr. David Day, a licensed clinical psychologist, an established therapist, a well known clinician, teacher, speaker, facilitator of seminars, workshops, and retreats. He's been a successful practitioner in the San Francisco Bay Area for over 40 years. So, Dr. Day, I'm looking for a therapist. Why would I choose you? What do you bring to the table? And specifically, why are you a good choice for some people?
Well, I would have to say the first thing that comes to mind is experience. I have been doing this a long time, and so there is something to be said for that, and especially having a long-term practice. And if you're successful, there's a reason that that's the case. Some therapists come and go, and they don't sustain a long-term practice. Um, but also, of course, the longer someone's in practice, the more they encounter in terms of the different varieties of things that can plague people and cause them difficulty. So that experience goes a long way. Um, the other thing is about myself is that I do have the most advanced degree in the field. So along with psychiatrists, sometimes people get confused as to what's the difference between a psychiatrist and a psychologist.
Yeah, let's
And
stop right there. What is the difference?
well, the main difference is that the doctorate is in a different area. So psychiatrists are trained to prescribe medication. So it's a medical approach to psychological problems, whereas psychologists are trained to do assessment, testing, and talk therapy, if you will. So it's in a whole different role. Um, so many times, what someone needs help with requires a psychologist. So you might say, let's go back to the topic of assessment. So it's the domain of psychologists to do psychological assessment for the most part. There are some um, couples-oriented assessments that master's level therapists can get approved to use. But by and large, if it's diagnostic assessment, and there's a whole variety of diagnostic tools that we have available, that's what a psychologist does. We're also trained to recognize, because of that diagnostic background, more severe psychological problems. And although master's level therapists do some diagnosis, if you will, they really don't have the depth of training that a psychologist has.
Oh, so you've got the bottom line is you've got some tests that you are trained to administer that can really uncover who a person is and perhaps what is impacting them on their journey and their problems.
Yes, that's true. In fact, I sometimes describe it metaphorically like being similar to when you see a medical doctor. So often, when you see your doctor, they'll prescribe different blood tests or other tests, medical tests, and it does uncover things that the doctor either isn't sure about or may not be able to detect with an interview or a meeting with the doctor. So it's very similar in my field. Many times we can um, take an X-ray, as it were, about what's going on inside someone's mind, or in their relationships too. There's a number of good tools that test at a deeper level, things that wouldn't necessarily come up in conversation with a therapist.
So you could probably get to the basis of a problem much more quickly than a person who doesn't have access to these tools. It sounds like when you get a PET scan, people find out what's inside your body. And when you take some of these tests, you find out really what is the root cause of some of the problems that I may be having. Did I hear that right?
Well, that's true, Stan. The you can get to the bottom of things quicker if you do psychological tests. And I routinely use psychological testing for that purpose, and it saves a lot of time. Testing itself sounds expensive at the beginning because there's a concentrated expense on the tests as you take them at the beginning, but it honestly saves a lot of money and time by getting answers very quickly that you can do in an objective manner, uh, and you can get there eventually in talk therapy, but oftentimes it takes longer.
Now, can you do that online, or does that have to be in person?
No, in this day and age, almost every test that we have available, you can take online. It's all done with secure connections, and so it's gotten very sophisticated. We can get the results immediately. It used to be that when I started my career, we'd have to send off the scantrons or the answers that people make to the test, and then wait a couple of weeks to get things back in the mail. We've come a long way since then.
Now, your practice is centered in the Bay Area and on the West Coast. If I live in Virginia or Connecticut or Alabama, can I access you personally as my therapist, or is there a limit to how far your practice can reach?
Well, it's interesting. This is a big controversial issue in my field that uh, it's called the portability of licenses, and I would say in about two-thirds of the states, if your therapist lives in that state, you can live in any other state or any country and see that therapist. So it would be legal and ethical to do that. California is one of the few states that does not allow that. And so, um, it although people can contact me, I can't legitimately see them outside of California. I happen to have a license in Virginia because at one point I was considering moving there, but besides Virginia and California, no, I unfortunately I can't see people in other states.
Now, if I contacted you, do you have contacts in most other areas or could make recommendations to me if I'm talking to you about who might be appropriate in my area?
It would be honestly hit and miss. On the one hand, I belong to several professional organizations, and so I can look for possibilities within those. Many times I don't know the people, but they may have graduated from the same university that I did, or they may belong to the American Psychological Association. So there's that possibility, and of course with friendships that I have and people scattered around different places, I would know certain people, or at least I can refer them to friends who perhaps have found a therapist in their community, and they could narrow down their search that way. Um,
So, are you currently taking new people in therapy, or are you pretty well filled up in your practice?
Currently, I'm seeing I have openings to see people, so I'm taking new clients. Be happy to help with anyone that might contact me.
Do you do all of your consultation now online, or do you still have a physical office?
I do most of it online. It's we've gotten very comfortable with that in our uh, community and across the country, in the advent of um, the pandemic, and how we got very used to doing um, interviews and meetings via Zoom. And so that tends to be the case. But I do have an office that I share with another therapist. And so I have availability to see people in person as well.
So I'm interested in you. So do I best just call you, or do I connect with you on your website, or how do I contact you?
Well, on my website, and then I have a profile with Psychology Today and several other platforms. Probably the easiest way is to email me, um, and I'm not sure that we have that listed on on the banner that's going. But that's Dr. David Day at Comcast.net.
So
Okay.
if you're interested in talking to Dr. Day, give him a ring, send him an email, or look at his background. And he is open for new patients, new people to work with. And so, what a wonderful opportunity this could be for you. So, thank you so much, Dr. Day. What an intriguing and interesting whole background that you have.
Well, thank you, Stan. Appreciate the time with you, and look forward to seeing you again.
Okay, thank you.
Take care.